I'm Dave Duplay, and I'm here with Andreas Ullrich from the World Health Organization. Welcome. Andreas, coming out of Friday night in our advocacy in action meeting, what were your thoughts on what the advocates shared about the reactions to the essentials medication list that the WHO has put out?
So I was very much inspired about this gathering you have organized. I gave me new insights about the work of the NGOs. The essential medicine list of WHO is a key milestone which brings together these NGOs in their fight to more access to, let's say, care. Let me say, access to medicine is part of a broader context. I think we have convened this message. And they can play, NGOs can play a major role in acceptance of the essential medicine list, playing probably also a role in advocating for the production of medicines which are out of patent and might. We had examples of dropouts and shortages, even in Europe. So it's important that the private sector is stimulated to bridge these gaps, because we are not producing it as a WHO, and the NGOs neither. So we have to work together in a partnership, and in terms of an alert system, where we have shortages, you need to produce this, otherwise some patients will die. So this kind of exchange of information, alert, is extremely important.
So speaking of the shortages, there are shortages of cancer treatment. And there's a balance of innovation. But for the shortages, how many of the essential medicines are on that list, and what's your reaction to that? You heard the advocates say on Friday night, there's got to be this balance, right? And there's access, and there's cost, and there's older products, and there's innovation. How do we strike this balance?
I think first of all, we need to absorb the patient view and see what is feasible in a contextual perspective. What we want to do is save lives wherever cancer patients have cancer. But this cannot jump from 0 to 100% access. So every country has its own contextual reality, where there is a list, where there are trained doctors to prescribe medicines. We need skillful prescribers of this and follow, because it's a quite complicated regimen to prescribe cancer treatment. I know it because I am a medical doctor, and I did cancer treatment for quite a long time. So it is contextual. WHO is, and the essential medicine list is a catalyst. It's not, we are not imposing this list to every country. Every country can take this because it's evidence-based, it's independent, we have the best oncologists having had a say in developing the list. And every country will then take this and have a national dialogue with the private sector, with NGOs, and here the NGOs play an important role, and the professional organizations. I think in our dream, we would have national cancer planning steering groups, where you have all the key stakeholders talking about how best to develop a system, including medicines and training and national guidelines for treatment, right, which are affordable and which are achievable by the country. Yeah. And the essential medicine is one element.
Now you call the list a catalyst.
Yes.
What countries are taking that catalyst and doing it, putting it in operation well, and where do we need help?
Good question. We have some, in April, a report came out about the use of the essential medicine list, right, where we see some countries are really using it as a tool. other countries are not yet there, and the NGOs can play really an important role in using in better using the essential medicine, not only for cancer but in general, because the essential medicine list is in context with other health conditions. Yeah.
Sure.
So NGOs need to look where they are, which country they target, and get information about where the discussion is about licensing. Yeah.
Well, Andreas, thank you for all your work, and thank you very much for stopping by.
Yeah, thank you.
Thank you.